The Mayo Clinic is a very unique place, a very unique institution. Everyone at Mayo Clinic has in their heart and their soul that the only interest that matters is the interest of the patient, and you palpably feel that working here.
Colorectal surgery is a humbling but also rewarding job. The patients really have tough conditions, and the opportunity to partner with a team, to help those patients here at Mayo Clinic is an honor and a privilege.
Our division of colon rectal surgery, is one of the oldest specialty practices actually in the country. Where we are today and how we're looking at the future is really a formula that started with Dr. Buie, who is really the origin of this specialty at Mayo Clinic.
What did the Mayo Clinic mean to my grandfather? Everything. He just was so keenly appreciative of the brilliant minds and the individuals who were really striving to learn and do the very, very best they could for their patients.
I think one of the great qualities about Dr. Buie was that he also embraced strongly the Mayo's three-shield approach: patient care, education, and research. He was really focused on three main things. He was focused on the patient comfort. He was focused on the patient experience when they came to the clinic, when they were getting care, and then on patient outcomes, which of course ultimately is the most important thing.
When Buie started his practice at Mayo in 1919, the instruments at that point in time were very rudimentary, and he befriended an instrument maker here by the name of George Little, and he and George started making instruments together. Throughout his career, he continued to develop a plethora of different instruments to use to suit the needs of treating patients with anal rectal disorders.
We do use a lot of the same tools or variations of the tools that he developed in our practice today.
Dr. Buie was a true academician. As he continued to write and present more, he didn't only solidify his practice and his focus to Rochester, Minnesota and the Mayo Clinic, but both nationally and abroad. In the American Medical Association, they looked at their code of ethics that had not been updated since 1847. And in 1947, they decided to embark on a journey of updating their code of ethics since they were out of date. Buie was known as a literary perfectionist. In over 10 years, he rewrote the medical code of ethics for the American Medical Association and essentially rewrote it himself.
Dr. Buie was really instrumental in developing what it looked like to train colon and rectal surgeons. And despite all of the changes in medicine and surgery, the innovations, the technology changes, really our training looks very much the same as it did when he started it, which is really a testament to what he developed and what he was able to accomplish.
So I want to convey that appreciation in knowing about this celebration. My grandfather would be astounded that this was happening, and he would just be humbled, and he would be so thrilled that everything had grown to the expanse that it is today.
When I look back at our last 100 years, it's an incredible legacy. We are where we are today because of the dedication of so many people that came before us. I look at our vision as being consistent with a vision that Dr. Buie had, principles around what was important for the care of the patient. His vision at that time is the same vision we'll have going forward, and I feel privileged to take on that task of bringing our division into the future in a positive way for patients.